Recording. There's
There's
my 5, number 6. Today I'm going to talk to you all about PTSD. So think about a time when maybe you and your spouse got into an argument and you just thought they were acting irrationally, and maybe they had an outburst of anger and you just thought that you couldn't handle it. Maybe your spouse has PTSD. Being a soldier and going to war can often bring havoc on a person's life. Sometimes they just don't think that they have it, and they've been told that they do. It takes time and patience from all parties involved. I know as an Army wife, my soldiers' well-being is of utmost importance. Today I'd like to explain to you what PTSD is, how it can be affecting your life, and after listening to this information, you may realize that someone close to you has PTSD. PTSD is a mental health condition that is triggered by a terrifying event. This can be, some of you may have gone to war, or your husband or spouse has gone to war. It can be a person being raped. It can also be, if you've been in a natural disaster. We recently had a tornado through here. Those people might have PTSD. PTSD is marked by physical and psychological symptoms. Some of these can be, one big one can be flashbacks, and I have a video to show you of someone that had a flashback and something bad happened.
I couldn't sleep. I was having medical problems. I started drinking. And drinking's been my worst friend for the longest time. And no one believes this, but I never had physical with her. I never did. I was different. I punched out windshields before. I had thrown keys through walls and stuff like that. But I'd never hit her. And that's when, I don't know what happened, but I got angry with her. I got angry with her at that point, and I did push her. I pushed her, and she jumped away from me. And she landed in the tub. And this is, I've never told anybody this. This isn't even in the court transcripts. She landed in the tub, and when she came up, the hair was over her face, and she screamed. The loudest scream I've ever heard her scream, and I've been with her for 11 years, 10 of them were married. And it reminded me of those screams of fear with the mortars and stuff. But I grabbed her, and she bumped her head bad. And when I looked down, she was under the water, and I hit the water, release, and the water came past her face.
So he had a flashback of somebody screaming on deployment or wherever he was, and he reacted and he pushed her, and she died. Now that was an accident. He didn't intentionally mean to kill her, but still that flashback brought back something bad for him and made him do it. Also, another symptom can be emotional numbing. You might just make yourself an outcast and just not feel anything and not talk to anyone. Also depression and anger. Anger is one of the things that is, the anger is towards maybe you lost someone overseas, or your spouse lost someone overseas. Substance abuse. A lot of people abuse alcohol after deployments, or if they have PTSD. It's a big issue. Even drugs, which isn't as large of an issue, but also people do abuse drugs. And guilt. Maybe your loved one was overseas and the person sitting next to them in a vehicle died and they didn't, and they feel guilty for that. Maybe it should have been them. I made a copy of some symptoms so that you all had more to look at.
Thank you.
And this is out of the book, Downrange to Iraq and Back, which is right here. Good book. Thank you. Okay, so now that you know about some of the signs and symptoms, let's talk about how it might affect you and your soldier in your daily lives. So when they return home from deployment, they're expected to just reintegrate back in very easily and quickly. But maybe you as a spouse are wondering why they want to be at work or why they want to be with those people they were with for 12 months. And it might make you angry, but you have to just bear with them because they were with them, they went through things that they haven't been through with you. And right after coming home, they still feel like they want to be with those people. So you just have to let them know that you're there for them and just try to help them out. And also, another thing is you might not be sleeping because your spouse is not sleeping. Maybe they're having nightmares and it's waking you up in the middle of the night and then you're worried about them. Also, maybe they just can't fall asleep, so they're tossing and turning and then you can't fall asleep. So it can be really difficult to get along with your spouse after they come back home from deployment. And another thing with relationships, most people with PTSD do come back and reintegrate well with their loved one, but some of them, intimacy and normal relationships don't come as easy after they get back. According to, it's called She Knows, it's a health and wellness report that they have online, and it's some doctors. They say 5 to 10% of people that develop PTSD often experience lasting problems with relationship and intimacy. So 5 to 10% isn't that bad, but it does affect some people. Which also leads me into telling you how you can help your partner or your spouse to find out, to know that they have PTSD and just to get them help. When PTSD is affecting a person's life, they really need to get treatment so that something awful doesn't happen like you saw in the video. Some things can be done. One thing with your relationship is communication. I read in the book also that there's something you can do called a timeout. And when you're arguing and you're angry, first you want to make sure there are no children around. Do not argue in front of the children. Then you can call timeout. And you need to know that when one person calls timeout, that means that's end of discussion. You walk away and say, come back in 30 minutes. Because obviously there's something at hand that needs to be discussed, which is when you're chilled out a little. So after you come back, try to use I statements and not you statements. Because when you're saying you do this, you do that, it's like accusing them. And also be open to what their ideas are and what they have to tell you, because they just might think that you're criticizing them. So you need to just be open and know that there's a reason why they're saying what they're saying. For different therapies, the doctor and the patient with PTSD, which could be your spouse, sitting here today, they will decide on a good treatment. It may be counseling, it may be medication, maybe both. One treatment that I read on that I found interesting was called PE therapy, and it's prolonged exposure, where you actually sit there and talk about your experiences over and over until it no longer bothers you. They say that it works for some people. I've never known anyone to do that. Have you done that?
Yes.
Yeah. Does it work?
Yeah, it does.
Good. And then cognitive therapy, which is something that we all know, it's like talk therapy. So you want to talk about what you've been through and better understand why it's affecting the way you think about things and maybe giving you emotional outbursts and things like that. So all these things your spouse might be going through that you just need to make sure that you know that they're not doing it on purpose and that they're trying to get help. Also medications, there's antipsychotics, antidepressants, anti-anxiety medications, because anxiety is a big symptom of PTSD. And also sleep aids. It can be something natural over the counter, or you might need a prescription to help you sleep, which is also going to help your relationship. In conclusion, PTSD can affect anyone. The emotional and psychological stresses of war cause our loved ones to get PTSD. And for us to understand how to see that our spouse has them, to know the signs and symptoms, and to just be by their side can help them get through a hard time in their life. And maybe knowing this information that I've given you today can help you either save your relationship or save someone's life one day. Thank you.
Nice job. Nice job.